everyone, I'm Dr. Winstead and I'd like to welcome you. This website is designed to help Keuka College occupational therapy students learn to better write and evaluate critically appraised papers, or CAPs. Each section of the CAP has a page on the site with links to external resources and examples, video tutorials from our own Keuka College students, as well as helpful tips from the instructor. These resources will be introduced early in the curriculum and can be used in courses throughout. We'll be adding additional content to the site over time, and we certainly welcome any feedback. This video provides an overview of evidence-based practice generally and an introduction to critically appraised papers, which are one tool that you can use to make informed practice decisions. To get us started, you can see that evidence-based practice is defined as the integration of three components. Number one, the best available research. Number two, the practitioner's own skills and knowledge. And number three, the needs and goals of the client. These three components come together to allow the OT practitioner to make good practice decisions. Evidence-based practice is not the same as research, as you can see on the slides. Evidence-based practice is defined as the process of locating, evaluating, and applying evidence that already exists to practice, whereas research is defined as the process of generating new knowledge through systematic investigation. As you've all learned in class, there are many reasons that evidence-based practice is important. Number one, of course, is that we need to ensure quality services for our clients that are actually based on the best available evidence. Number two, we want to increase clinical efficiency and effectiveness. Number three, we need to fulfill our professional ethical responsibilities. We have an ethical responsibility to make sure that we're doing things that actually work. Number four, we need to meet the demands of clients and families, as well as policymakers, administrators, and of course, third-party payers. This slide reviews the steps in the evidence-based practice process, starting with the identification of a clinical problem and an evidence-based practice question, then moving to a search of the available literature. Once you find literature, it needs to be appraised and synthesized. Then that literature needs to be applied to the practice situation. And then ultimately, the final step in the process is evaluating the process itself as well as the outcomes to make sure that they match your clinical need. A critically appraised paper is one tool that can help occupational therapists to make informed practice decisions. It's defined here as an appraisal or evaluation of an individual research study. It includes multiple sections that summarize that study. So it includes the study's goals, the sample or participants, the design, an explanation of the outcomes, limitations, and then ultimately the application of the study's outcomes to occupational therapy practice. Currently, CAPs are published and available on the AOTA Evidence Exchange, which is linked here on the page. However, from spring of 2018 forward, CAPs are going to be not only published on the Evidence Exchange, but shifting toward presentation at AOTA's National Conference. And then finally, we have the criteria for choosing an article for a critically appraised paper. First, as you can see, it needs to be a quantitative research study describing an intervention that has relevance to occupational therapy. It needs to be published in a peer-reviewed journal within the last 10 years. It needs to be level 1, level 2, or level 3 research according to the hierarchy used by AOTA. And finally, it cannot duplicate any CAP that is currently on the Evidence Exchange. That brings us to the end of this introduction. Thank you for accessing the website, and good luck with your scholarly work.